Good morning and welcome to this morning's hearing on the fiscal year 2014 budget and the fiscal year 2015 advance appropriation request for the Department of Veterans Affairs. Thank you to Secretary Shinseki and your team for being here this morning. I know you've had been very busy over the past couple of weeks as you work to get this budget request out. 1 month ago, the Senate passed our budget resolution. There was plenty of debate, plenty of disagreement, a long markup in this committee, and extensive consideration on the floor. But there was never any question about the importance of providing for our nation's veterans. The budget resolution protected funding for veterans' benefits and services. It also included deficit-neutral reserve funds to assist in several important policy areas, including eligibility and delivery of benefits, rural health care, education and training, veterans' families, and homeless veterans. The Department's budget submission will help inform us as we move forward on discussions with the House on a compromise budget resolution. The President's request is $152.7 billion for VA in fiscal year 2014, $55.6 billion in advance appropriations for medical care in fiscal year 2015. Overall, this is a strong request, and it represents an increase of more than 10% over last year. It also makes important investments in some high-priority areas. As we have discussed in the past, it is important that the Department follows good financial management principles. This means being straightforward with Congress about what the Department's real needs are. It also means accurately projecting costs and savings. And it goes without saying that we expect the Department to be good stewards of taxpayer dollars, especially in this difficult budget environment. There is no place for wasteful spending or inefficiency. One of the newest developments is VA's recent announcement that it will focus on expediting claims that have been pending for more than a year by granting provisional ratings. This will allow veterans to receive benefits while their claims are finalized. I'm pleased the Department is taking action and trying a new initiative to make a difference for our veterans, but I still have a number of questions about how this will be implemented. Certainly, we can't maintain the status quo where almost 70% of our veterans are waiting 125 days or more for their claims. Secretary Shinseki, considering the steps you've taken to address this problem so far, I think you share my concern and dedication to solving this. So I look forward to exploring this new initiative with you today. I was pleased to see the Department requested almost $7 billion in funding for mental health care. This is an increase of more than 7%. During the last Congress, we took a hard look at mental health in VA and found some serious problems. VA was generally providing good mental health care, but understaffing and long wait times were plaguing the VA and keeping veterans from the care they needed. Importantly, we also found the Department did not have an accurate, reliable way of measuring the need for mental health care and of distributing its staff effectively. We asked the Department to undertake a number of reforms to improve access to care and bring down the unacceptably long wait times. This included key changes that were part of the Mental Health Access Act. Today, I hope we'll hear more about the progress the Department is making in implementing those changes. As I have said before, not every veteran will be affected by these invisible wounds, but when a veteran has the courage to stand up and ask for help, the VA must be there every single time. VA must be there with not only timely access to care, but also the right type of care. This is especially important at a time when 22 veterans every day are taking their own lives. The VA has a number of good initiatives, such as the Veterans Crisis Line and the Suicide Prevention Coordinators, but we clearly need to do more. As you know, women are the fastest growing part of the veteran population. The VA has needed to make major changes to ensure there's a full range of health service for female veterans, that facilities are safe and privacy is protected, and support services are available. The requested $422 million for gender-specific care for women is a 13.7% increase over last year. I will also continue working to end the terrible epidemic of military sexual assault in the services. In the coming days, I will be introducing legislation to help prevent sexual assault and protect the victims. At the same time, the VA must continue to provide those suffering from MST. Only a small fraction of sexual assaults in the military reported, so the VA has to provide both the highest quality treatments, but also outreach and screening to help the victims get into care. Developing a seamless transition is another challenge the VA and DoD continue to face, though we have made important progress. The requirement in the Vow to Hire Heroes Act making the Transition Assistance Program mandatory, along with a major overhaul of the curriculum, has created a much more useful tool to assist service members who are leaving the military. And the feedback I've received is that even colonels and sergeants, majors found the training invaluable. If even those senior leaders are benefiting from the help on resume writing and VA resources, we're doing something right. Other requirements to expand job opportunities and eliminate barriers to getting civilian licenses and credentials are key to combating the unemployment rate for veterans, which is still far too high. We've made a great deal of progress working with employers to encourage them to hire veterans. And I will continue to engage our private sector partners to help them understand the skills veterans bring to the table and why they make the best of employees. Getting our veterans into education programs, good jobs, or starting small businesses doesn't just benefit the veteran, it helps us grow our economy and the middle class. It builds on the investments we've made in our veterans as they continue to help our communities, our businesses, and their fellow veterans. While we're making these investments in our veterans, we must also continue to invest in VA infrastructure. I have concerns about the proposed cuts to major construction and non-recurring maintenance. The Department is proposing a 47% cut in non-recurring maintenance and only $342 million in major construction funding. This comes while the Department still estimates it has between $54 and $66 billion in infrastructure needs. I was pleased to see the request includes funds to complete work on the mental health building in my home state of Washington at the VA hospital in Seattle. Information technology also provides a critical role in many of the Department's major initiatives, and it's a key part in giving our service members a truly seamless transition from active duty to civilian life. The President's budget request includes an overall 18% increase in IT funding for the VA. This request includes a number of important priorities, such as the continued development and implementation of the Veterans Benefits Management System. The request would also fund further development of the virtual lifetime electronic record, which, while implemented regionally, has not been rolled out nationwide. However, the recent announcement by VA and DoD that the departments will no longer pursue development of a single electronic health record has raised important questions about the future of the IEHR program. The departments must clearly define the path forward with this important project and address the underlying reason for the program's abrupt change of course. VA and DoD have to make sure there is a clear strategic leadership to guide further development of the IEHR program. So, Mr. Secretary Shinseki, I want to thank you for your dedication and leadership over the past several years. It is not easy to steer the Federal Government's second largest department, and it's not easy to make the changes that are needed. You set some very ambitious goals, including ending veterans' homelessness, breaking the claims backlog, and transforming the way the VA delivers health care. Setting these high goals is a good thing, and I'm confident you set these goals because of your continuing demand for excellence on behalf of our nation's veterans. We recognize the good progress that has been made, but we will continue to push you to meet those goals. So I'm looking forward today to a constructive discussion about the challenges ahead, the concerns that we have, and what we can do to provide the resources and authorities that you need. And I will now call on Senator Sessions, our ranking member, for his opening statement.